This is Vanessa's story. It is also Russell's story, and it is one shared by millions of people in Africa, the Middle East, and elsewhere in the world. Their parents, siblings, partners, friends, and caring, concerned medical practitioners and scientists provide support, but it is a journey that they each traverse as an individual. Come along with us and learn more about sickle cell disease and how it affects us.
I have sickle cell anemia. My specific genotype is SC, which means I inherited an S from one parent and a C from the other parents. I've had this my whole life, but then growing up, I was under the care of my parents, so I did not know too much about it when I was a child. My father told me that my first crisis was when I was 3 years old, and my description of that was my hand was breaking, which I must say is very accurate. But growing up, I have learned to live with my condition and also manage my condition. I I think that I am trying as much as possible to live as normal as I can, and recognizing that I have things that I can and cannot do, and then doing what I can to make sure that I'm always healthy and always safe and avoid as many crises as I can.
I was born with it. I think I was diagnosed about when I was 6 months old. I was a baby at the time, so I only know what I've been told. And at that age, it was characterized with a lot of pain crisis, swelling hands and swelling feet. Basically spent a lot of time in hospital. So casually, at the children's block of Kolebu Teaching Hospital, many of the nurses or the staff knew me because I was there a lot. And from about 6 months till about I was 14 or so, I was always in and out. So that's how I got to know about living with the condition.
Thinking about how this experience molded me growing up, I will say that it made me recognize early that I have to do what works for me. You will see a lot of people doing so many different things, and you think that I should be able to do that, or I must do this because he or she is doing that. And I had to understand that, Vanessa, this may not be for you. So it has really helped me in everything that I do right now, that I'm always on my lane. I do what works for me. I'm not looking at anyone else. Yes, you get motivation from here and there, but at the end of the day, I have come to really understand that we're all on a path, and this is my path. And what can I do to get to where God wants me to get to?
I remember vividly the pricks, being given drips all the time. I have a scar on my hand from reacting to plaster. That became the norm. Like, I was always in and out of the hospital. Another one that sticks with me is there was a time when I was in so much pain that when people walked in and out of my ward and they shut the door, when the door was banged, it rippled through my body and I could feel the pain. So then it reminds me of what it feels like to be in pain. I was still in the children's block then, and so it stuck with me that this pain is not some pain that is a joke. It's really, really terrible.
Honestly, before I even started dating, my mother would always tell me that, Vanessa, you have to marry a man who has the genotype AA. Any other thing will not work for you because of your condition. So it has been drummed in my head. So from when I was young, I had to find someone who was AA. Now, I met different people who had AA. It doesn't mean it was an automatic thing, but then going in, I realized I had to have those conversations early. I'm not one to wait for a few years in a relationship before I determine that. Within a week or two, or at least a month of talking to someone, I will bring up that conversation. I'll be like, what is your genotype? Have you checked? We'll have a conversation about it, and then we'll see if this is something worth exploring or not. So me, I was just straight up. I was upfront about it. Even with my husband, I think within a week, I asked him, what is your genotype? You need to go and check. So he already knew all that information, but he didn't know so much. So after, I was like, you know what, go and have time, just think about it, because being with someone who has sickle cell is not just like an easy breezy thing. You need to have the heart and the attitude and be willing to adjust certain things about your life. So you have to go and think about it. So I gave him time to go and think about it, and then come back and tell me, is this something you want to go forward with? And he was like, yes. I have met others who have said, no, I can no longer do this. And honestly, I have nothing against them. And I think I appreciate the honesty of telling me that this is not something I can do. That way I know that I'm starting this journey with someone who is honest and telling me that, no, I'm not ready to have that extra stress.
I also remember times when my parents would be by my side, and sometimes my mom especially, when she'd cry because she could tell how much pain I was in. So yes, there's the pain that I was dealing with physically, but it also came with some psychological trauma as well, not just for myself, but for my family as well.
We have heard from Vanessa and Russell. Now let's hear from the experts.
Sickle cell disease is a blood disease. The name sickle cell comes from the red blood cells that are normally round and soft turn into these sickle-shaped cells. They're like C-shaped cells, and sickle is a farm tool that is used mostly in Europe. These cells are different from normal because of a chemical inside them that we call hemoglobin. Hemoglobin is the chemical that carries oxygen in our red blood cells. Red blood cells are normally soft, very squeezable, and they have to be able to squeeze through very, very tiny blood vessels, tubes through which blood flows, in order to deliver oxygen that they pick up from the lungs to the tissues. Sickle cells are different because they carry a different type of hemoglobin, and when that hemoglobin gives up its oxygen, it begins to turn into a gel, and it forces the cell to adopt these abnormal shapes and also become stiff. So they cannot squeeze through very small blood vessels, and they can block the circulation. Also, they can break up easily, causing a low red blood cell count or anemia. The disease is famous because it causes a lot of pain, and the pain comes from the inflammation of the tissues when they lack oxygen. When these red blood cells block the flow of blood to any part of the body, that part of the body can become damaged. And the most common of these tissue damage is the pain that people often call crisis. But there are many, many other complications of the disease.
Not everyone will inherit sickle cell disease, but in Ghana we have about 25% of the population having the S gene or the C gene. What it means is that for every person who is born, you have two main genes that determine how your blood is formed. And for most people, it is just an A. You get an A from your mother and an A from your father, and so you are AA. So 75% of the population, they have A genes for both parents. However, there are some parents who are carrying an S in addition to the A. So they do not have AA, they have AS or AC or AD. So such parents, when you have somebody who has A plus another gene that is not an A, so it could be AS or AC. If you have two people, even though they are very healthy, if they choose to have a child, the child can pick the S from one parent and the S from the other parent, or the S from one parent and a C from the other parent. So wherever there's an S, if you add another gene that is not an A to that S, you get sickle cell disease. So the other gene that you may add to that S can be one S, or it can be a D, or can be a C. And so the child then inherits sickle cell disease.
So at birth, babies with sickle cell disease actually look healthy, even though we can tell through blood tests that they have sickle cell disease. And in the first few months of life, they look just like a normal child. They will gain weight, they will do just as well. But in the first year of life, our body switches from making baby blood to adult blood. And it is as the adult blood increases that the disease begins to manifest itself. Without testing, in the first year of life, most doctors and nurses, and certainly the parents, will not be able to tell that their child has sickle cell disease. But as the child gets a little bit older and these abnormal cells take over their blood circulation, then some of the problems begin to develop. One of the earliest things that parents would see would be swelling of the hands and feet of children who otherwise looked healthy. They may be 7 months of age going, and if they are the walking age, when this swelling of the hands and feet occur, they may have started walking, then they will stop. This would be the first manifestations of the pain episodes that people with sickle cell disease would have. Throughout their life, the pain will come and go, but there are many other complications. The fact that they have these abnormal blood cells that break down so easily makes them anemic. That means they have a low red blood cell count and their HB level, hemoglobin level, is low. That makes it difficult for them to be able to participate in activities that demand a lot of energy. So running and playing very hard that children will do, one with sickle cell disease may not be able to do it as well.
We have one of the highest levels of sickle cell disease anywhere in the world. It is thought that the genes for sickle cell disease, the S and the C, it is thought they originated somewhere along the west coast. And actually the C originated from Ghana, the northern part of Ghana. So that's where the C came from. So we have a lot of people in the north who have sickle cell disease.
There's a yellow chemical that forms in our blood. We call it bilirubin, and everybody has bilirubin. That's what makes our urine yellow. But if you break down a lot of your red blood cells, then you make a lot of bilirubin. So many people with sickle cell disease with their eyes, where the white of the eyes, have taken on this yellowish tinge. And often that's one of the first things that people may notice about somebody with sickle cell disease. But the disease affects every part of the body because blood goes everywhere in the body. So there are many major complications that they have. But the only way to know that somebody has sickle cell disease is not to wait until you see these symptoms. It's actually to be tested, to be screened. And the best time to do screening is at birth so that we can begin some of the preventive treatment.
Now, what to do for somebody who has sickle cell disease? The best starts from before a parent has a child. We encourage all to-be parents to check their genotype so that they will know if they are at risk of having a child with sickle cell disease. It does not automatically mean that because you are AS and your spouse is AS, you will have sickle cell disease. But it just means that there's a chance that your children will have sickle cell disease. So the first thing is to check. And once you know you have the trait, then you know your risk. So that by the time you are going to have a child, you know that there's a chance your child will have sickle cell disease. Secondly, we recommend that every baby born in Ghana should be tested at birth for sickle cell disease. It's important to check before the child gets to the stage where they start falling sick. So we have something called the newborn screening for sickle cell disease. As soon as your baby is born, request a lab form for your baby to be tested for sickle cell disease. And that is what is done at Noguchi for all babies born who need to be tested for sickle cell disease. So we recommend this test for everybody, whether you are sure you are AA or whatever genotype the parents may have. We recommend that they get the baby tested at birth for sickle cell disease. Then, if you are tested at birth and we find out that you have sickle cell disease, then we can give you a doctor. We would link you up with a doctor who will follow you up all the way till you are grown. And one of the basic things we do for children who are diagnosed with sickle cell is to put them on penicillin. Because sickle cell disease, the most devastating thing that can happen to them is bacterial infections. They get bacterial infections and they usually don't do so well with it. So we try to put them on medications that will prevent them from getting the infections.
About sickle cell disease, what it is, and what can be done to make things easier for our brothers and sisters who have to live with the condition on a daily basis. And let us remember that family and friends are part of the stories of Vanessa Russell and others like them.
It was devastating. It wasn't the best of news. You know, your first child, and you have all the plans and everything lined up in your head, and then you're told that this is it. And of course, I mean, we had been in school with people who had sickle cell, and so we knew what people with sickle cell went through and so on and so forth. So yes, I mean, it wasn't the best of news, but then at that point, what do you do? So we did have conversation with the pediatrician, and he assured us that there was nothing to be scared of. There was a very competent team at the Kolebu Children's Block who would take care of it. And so he did the referrals, and were transferred you know. So that was good. But it wasn't the best of news at the time. Yes. The doctors in Kolebu, they had their drugs, you know, and things that were administered based on lab results and so on and so forth. So yes, at the time, the team at the Kolebu Teaching Hospital were very, very, very helpful. You know, they knew exactly what to do. And so as parents, we didn't really need to worry much, you know, because once we got in there, the important thing was getting in there. And once we got in there, everything was sorted out.
I am a brother to two siblings who have sickle cell disease, and I've been taking care of them since I was in SHS. When my brother gets sick, I have to come and stay with him at the hospital. Sometimes I move from the hospital to school. I attended Accra High School, which was a day school, so I have to stay with him in the hospital, bath in the hospital, and go back to school. And I've seen a lot of patients with sickle cell suffering, some dying in my presence, and I just didn't like it at all. And I want to fight for them as much as I can in my own capacity so that they would have a comfortable life.
It is now clear that sickle cell disease affects us all, whether we have the condition, know someone who does, or neither of the above situations.
The way sickle cell affects families is like you're saying, it's either positively or negatively. It depends on the way you, the parent, decides to take it. Negatively, there is the stigma. Society tends to blame you, the parent, for not knowing your status, not knowing your wife's status. Why did you get married when you knew you were both, you know, positive? That is one. People say all sorts of things. Some of them will say it in your face, others will say it behind you. But again, like all negative things, it depends on how you take it. If you want it to affect you, it will affect you. If you don't want it to affect you, you push them all aside and you move on. And for us, having and keeping Russell healthy was our purpose. It wasn't about what people were saying. Rather, it gave us the opportunity to read and learn and talk to people about sickle cell, okay? And what one could do. I mean, looked out for parents, other parents who had children with sickle cell, in terms of diet, in terms of what to do and so on. So it gave us an opportunity to read and learn, and then also talk to people about sickle cell. The one thing that I can tell you is that if you have a child and you love that child, whatever pain that child goes through is your pain. And sometimes the pain is even more, because if you're not careful, you start blaming yourself, okay? And then it can get bad and can get worse, you know. So you just need to be there and be strong and make sure that when that child is in that crisis and needs someone to look up to, you are there and you're ready to face it and give him all the encouragement that you need.
Living in America, when it comes to healthcare, living in America and compared to Ghana, I would say where I live in a very small part of America, very small town, very, very small town. And because of that, there are not a lot of people who have sickle cell here. So what I came to learn was the people at the hospital, doctors and nurses, they know about sickle cell, but they haven't had a lot of experience treating people with sickle cell. So some of the things I expected them to do for me immediately when I had a crisis, they didn't do. So I would say right now, sometimes I'd be like, if I was in Ghana, I would have had this and this done for me already. But here, I have to really advocate for myself. I have to make sure that I try as much as possible not to get sick, because I don't know who I'm going to meet at the emergency room who may know about sickle cell, may not know about sickle cell. For one instance, I was taken to the emergency room and was not given any pain medication for like 3 hours. That wouldn't have happened to me if I was at home. So in as much as they have the best medical care, I think that this is another reason I want to create awareness in spaces like where I am in right now, because there are going to be more people, diversity, like globalization is happening, so people need to know about this condition so they know how to treat them as well.
In my personal development, I think I've gotten to know more about sickle cell disease, and also I I can identify when there is something wrong in their care. For example, when I know that maybe he's not eating too well, I know that there is something wrong. We have to go to the hospital before situations become worse. I know that they have to prevent mosquito bites as much as possible, preventing malaria, because I know that malaria can cause a lot of problems in sickle cell patients. And I know that when the weather is cold, they have to put on their pullovers to prevent catching a cold, which could also cause hospitalization. And I also know that they have to take in a lot of fruit and vegetables and all that to also keep their immune system up, so that to prevent bacterial infections and all that, which will help in the hospitalization of patients.
As individuals, families, communities, businesses, and as a nation, we all have a role to play in coping with it. Let's work it out.
I'd like to say that they should remember that they are special. They were born for a reason. They should discover that purpose and live it out. Do not let anybody limit you. And there are so many stories. I know people who live with a condition who they have drowned their dreams and aspirations because they think that they are unable to pursue them because they live with this condition. It might be a little more difficult, but it doesn't make you unable. And so, like I said, I put my trust in God. I depend on Him solely to help, because He created me. And like I said, I have a purpose. And so once I discover that purpose, I can only depend on Him, simply trusting Him every day to see me through. And so I'll tell other persons living with sickle cell to live in this consciousness that it doesn't deter you from doing what you want to do. The only thing that deters you is you. So set your mind on the things that you want to do and ask God, trust God to help you, and you'll live through it.
First of all, it's through no fault of yours. So don't blame yourself. One, go out there and look for the best that you can for that child that you have who has sickle cell. Modern medicine has made life much, much easier. And so don't panic. Look for the appropriate health facility. Go in there, and I am sure that you will get what you require. Join or talk to the relevant people, and you find that your situation is not as bad as you think it is.
We want to congratulate all parents for the good work they are doing. Even when it is raining, parents will come to clinic and they will come pick their medications. They will do the labs that we request every visit. They would give their kids the medication every single day, and up to 3 medications a day. They are able to convince these little ones to take the medications every day. We think our parents are phenomenal. They are helping these children do very well.
While government is aware of this problem because it's so common and there's so many Ghanaians whose families have sickle cell disease, government, and it's not Ghana alone, I would say all sub-Saharan African countries where this disease is common, no government has a comprehensive program of how to manage sickle cell disease. So we don't have newborn screening for all the children in any country in Africa. We don't have all the preventive penicillin prophylaxis, which is very cheap in all these countries. There are few organized sickle cell clinics. Ghana now has 18 organized clinics when we used to have only 1. And our goal from the Sickle Cell Foundation and Ministry of Health and Ghana Health Service points of view is that we should continue to grow these centers.
Going forward, I would like Ghanaians to take sickle cell very seriously. I would like them to understand that it's not just one of those diseases, but it's a very life-threatening disease or condition that should be taken seriously, and everybody should know about it, because we all have a part to play. You may think that, oh, I don't have sickle cell, but you may have the trait and you can pass it on. So knowing about it will allow you to make an informed decision about it so that you don't pass it on to your children, because this affects your children, it will affect you financially, mentally, all those kind of things. So let's not take it for granted. And I know that we can all work together to eradicate sickle cell.